Good morning, students. So we will continue with the counseling and guidance. Okay, so next today we will end up the classes with two videos. So this will be video 5. Okay, so today we will see management of crisis. Okay, so what is crisis and what are the various factors that are responsible for crisis, phases of crisis, and then we will see how to manage with crisis. Okay, so when we say crisis, it is a psychological disequilibrium occur. Okay, so when we say equilibrium, it is a balance. Okay, here a stress, or something that happens which actually causes a disequilibrium, imbalance psychologically. So that is termed as crisis. So when a person confronts a hazardous circumstances, which is an important problem to deal with, as he can neither escape from the problem and is even unable to solve that problem. Okay, so when can it happen? So when a person is actually confronting or facing directly a hazardous circumstances. Hazardous means problematic. It can be, a loan where he is not able to pay, or it is a natural disaster. Okay, now pandemic itself is such a crisis, right? So economy has come down and many have lost jobs. Okay, so it is a crisis. And then we also see there is no place to escape. Now because of this pandemic, we cannot move to other, states, or neither can you fly abroad, right? Or it can be a disaster, okay, like a flood, okay, that comes in. Okay, so what can we do? Can a person escape from earthquakes? No, we cannot. So we have to face it. It is an hazardous situation where a person cannot escape at all. He has to face it, or say death. Okay, death of a loved person or very important person of the family. So a person has to face it, though it is causing a lot of stress. A person has to face it, and he has to encounter, he has already encountered, now he has to see, what are the ways how he can escape, or how to come out, not escape, come out of the death that has happened, the pain. Okay, so it can be like disasters, example disasters, or home burning of a house. Okay, so that is crisis, which causes a psychological disequilibrium, and it occurs when a person confronts a hazardous circumstances, is an important problem to deal with, as he is neither able to escape from the problem and is even unable to solve the problem. Okay, so what are the factors responsible for crisis? So distorted perception, which means misperception between a teacher and a student, where a teacher has misunderstood a student, and because of which she is treating him badly, or a student has misunderstood a teacher and he is not able to cope up or being disciplined under the teacher. So inadequate support. Okay, so that is also one of the responsible factor of crisis, where you don't get adequate support from the government during the time of disaster. Ineffective coping mechanism. Psychologically, a person is very weak. He or she is not able to cope up with the problem. Okay, so that is ineffective coping mechanism. So when you see crisis, you see different types of crisis also. Dispositional crisis. So that is crisis occur due to response of an external stressor. Because of an external stress, okay, it can be losing of a job, or it can be a burnt house, or it can be a disaster like earthquake or tsunami, okay, or pandemic that is happening, which causes stress, that is called as dispositional crisis. Second one is anticipated life transition crisis. So anticipated is, you expect something to happen, you're on wait. Okay, so life transition crisis. So due to change in normal life cycle, an individual feel lack of control. So if there is some change in the normal life cycle which affects him, and where his life cycle is being affected, then that is called as anticipated life transitions crisis. So this crisis actually affects his personal individual normal routine. Thirdly, traumatic stress crisis, trauma caused because of any trauma. Individual feels emotionally defeated. Sometimes it can be love failure. Okay, so love failure can again emotionally drain a person, or not becoming very successful in the field where a person wanted to become successful. Okay, all these are certain trauma which affects a person emotionally. Okay, sometimes it can be that a person is ill treated in the family, okay, or ill treated because of his poor performance in the exams or failure of an exam. All these can become very traumatic situation for a person. Next, you have maturation or developmental crisis. So when we say maturation or developmental crisis, this is due to underlying developing issues. So as a person is growing, if there are certain developmental issues in a person, then that can lead to crisis. Okay, maturation or developmental crisis. So there are, in third year you will be studying growth and development. Okay, in every stage a person has to attain all the development. If maturation is not proper, okay, then it can lead to certain crisis. So these are types of crisis. So after factors, we have seen types. In that you have dispositional crisis, anticipated life transition crisis, traumatic stress crisis, maturation or developmental crisis. Next we'll see phases of crisis. So under that, we will be seeing what does it explain. So there are mainly 4 types of phases. Phase 1, precipitating crisis, which causes anxiety. So any kind of external factor or stressor, that is precipitating crisis, which causes anxiety in a person. It can be like theft from home. Somebody stole properties, or somebody has stolen money or jewels from the house, or burning of the house. Okay, so this can lead to crisis and anxiety in a person. That is phase 1. Phase 2, using previous problem solving techniques. If technique work, anxiety is released and crisis does not occur. If unresolved, increase anxiety, discomfort and confusion. So if the person already has such encounter with crisis, how did the person cope up? So we need strong emotional strength. Actually, we require emotional strength, psychological support, okay, good coping mechanism. So we have to help the person to use the same kind of solving problem. So usually whenever such thing happen, faith in God actually helps us to overcome the barriers, knowing that God is in control, okay, and He will take care of the needs, and He will make sure He will provide. So that is very, very important, because sometimes if they do not have faith, then again it can lead to loss of crisis. There are people who don't believe in God, okay, there are atheists, but then, but still they should have a strong emotional, strength, okay, or the capacity to overcome the problems. We should ask the person, or find out, see if he is a person who believes on God. We can always encourage him, that God is there to help him. Or if he's an atheist, they don't believe in God, then accordingly we should be able to provide them with the techniques or the coping mechanism they had used earlier to come out of the problem. So if the technique works, according to them the coping mechanism works, then it is good. Their anxiety will be alleviated. If it is not, then it can lead to crisis. It is unresolved, then anxiety will be more discomfort, confusion. It can also lead to some physiological problems in the person. Okay, so precipitating crisis or any factors that can lead to crisis. Secondly, we have to assess any previous coping mechanism and use the technique. If it is working for the person, then they get resolved. Otherwise, if unresolved, their anxiety increases, physiological problem increases, discomfort and confusion. Phase 3, individual either make self-use of internal or external sources or take guidance and counseling from others. New techniques are learned to solve. If effective, no anxiety. If not, stress and still in crisis. So now we know that his own mechanism, coping mechanism is not working for the person. Then we can always help them to make use of internal or external resources, or allow them to come for counseling and guidance. Guidance and counseling can be provided for them, teaching them various techniques as we have already studied, right? So various techniques of counseling We have studied like desensitization, relaxation, aversive conditioning, reciprocal inhibition. So all these techniques can be taught to them by the good counselor, and make sure that the stress is coming down. Fourth phase is tension occur beyond a further threshold, newer techniques, panic level is not resolved, and disorganization of individual occur, need for referral. So now when they come to guidance and counseling, we teach them various techniques. If the person is able to cope up with the taught, guidance and counseling techniques, it is fine. If not, what can happen? Tension, if it is too high, it is beyond a threshold where a person is not able to just think or imagine, he is not able to cope up with the loss, then what can happen? That's when they actually end up with some psychological problems also. So this might require referral services to hospitals for treatment. Okay, if the panic level is not resolved, then referral has to be done. So these are the four phases under crisis. Phase 1, because of their stressors or precipitating crisis, a person can end up having crisis. Phase 2, try to find out what are the techniques, see if it is resolved or unresolved. Third, give them counseling and guidance, train the person with the techniques. If he is able to cope up, then it is good. Okay, and then fourth phase, here the person is not able to bear the loss, it is beyond his or her threshold, then referral cases is required, because it leads to disorganization of an individual. Okay, their mental ability will be totally disturbed, they might be in confusion. Okay, so in this cases they need referral. Okay, so those are the phases. Next we will see management of crisis. How do we do this management? So we have to establish IPR, interpersonal relationship has to be maintained. Then working relationship has to be built with the person. Make use of reality oriented approach. Okay, so you first talk with them. That's what we've been saying in counseling, right? Steps and phases. So you talk, maintain good IPR, then working relationship. So you have to set up reality oriented approach. Don't tell them which is not achievable. Okay, for example, if a person has lost his close friend or close relative in the family or head of the family, you cannot tell them don't cry. Crying is a kind of mourning, and this will be there in a person. So usually when they cry, okay, they try to ventilate their feelings. That is very important. So you tell them don't cry, and then you should not be like this, be strong, what will others think? Oh, you are a man, you cannot cry. Nothing like that. Even men cry, and crying is one of the kind of exposing or ventilating their feelings. It should not be hidden, and it is okay for a man to cry, it is okay for a boy to cry. They too have emotions. There is nothing wrong, there is nothing telling, oh, you're a man. No, you cannot. So when you set goals, make sure that it is reality based, it is practical for a person to follow. Be with the individual as patient is experiencing panic anxiety. So suddenly they will show a lot of anxiety, they will start breathing very fast, and they will cry. Just be with them, don't confront them, be with them, give them psychological support. Encourage the individual to verbalize true feelings, then allow them, when they are able to speak, ask them to speak out, ventilate their feelings, provide an atmosphere where he can express the feelings. Make sure he's comfortable, not too many people are crowded. Okay, and then set firm limits on aggressive and destructive behavior. So psychologically, if they are disturbed or distorted behavior, they start throwing something, or they are wanting to harm you. So what do? You set borders, limitations. Tell them you can raise your voice and say, now sit down, don't move, listen to me. Okay, so that will help them to give their attention towards us. Okay, so when their behavior becomes aggressive or harmful or destructive, help the individual to find out the precipitating factors of crisis. So help him to find out what is it actually causing him crisis. The factor that is causing, is it because of exams, or is it because of somebody bullying him, or is it because of his personal issues? or is it because of any death that has happened. Let him recognize what is the factor that is actually leading him to crisis. Help the individual to make use of previous problem techniques. Already we have seen that in phase 2. Then guide the individual to problem solving process. Help individual to identify external support system, that is counseling, guidance, so he can come if he is not able to cope up, if it is beyond his threshold. Okay, he can always take the support of external system. Guide the individual to select the best alternative to solve the problem after weighing the consequences of each alternative. So when you sit with them, help him in making decision. When you help him to make, set goals, sit with him and tell him, is this okay with you, or shall we go to the other alternative? And then do a follow-up care. Once when he starts following, do a follow-up care, make a visit, okay, and check with him how he is doing. If anything has to be changed, you check it out. Okay, so be with the patient, give him good decision, making, okay, goal setting has to be done with the patient with proper guidance and counseling techniques that has to be used, and do a follow-up and see if the person is able to cope up with the crisis. So this is all about management of crisis. So we have finished that topic of crisis. So we have seen, what is crisis, what are the factors, types of crisis, phases, 4 phases of crisis, and management of crisis. So next topic we will see with the next video we will see with the next topic.